My lab is interested in how the lung gets injured and how the injured tissue tries to heal itself. If we can understand this process, perhaps we can intervene and make the lung injury less severe and thereby help patients who have this illness. So the one that most people will be familiar with would be pneumonia, so an infection of the lung. And so this person would get very ill and need to be in the ICU setting and sometimes on a ventilator. During the peak of the COVID-19 pandemic, all the patients who became very ill from COVID, they had a version of lung injury. And so our goal is to understand the mechanisms, both of the injury and of the repair process, in order to be able to help patients, come up with new treatments that would make the injury less severe, make the scarring less severe, to help people ultimately.